As we told you, the FDA authorized the Pfizer vaccine for kids ages 12 to 15 years old tomorrow, or teenagers, if you will. Tomorrow, the CDC meets to decide if it's going to do the very same. Here to answer your questions about that and so much more is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Doctor, thank you once again for joining us. We are getting a lot of questions from our viewers about this new age group. First one that we have: how can doctors say that there are no long-term health risks for kids if these vaccines have realistically only been available for a short time?
It's a good question, Maria. And remember, the FDA looks through a lens of safety. Safety is most important when you're trying to give an emergency authorization for these kids. Remember something, though. We have a long history with many different types of vaccines. We know that if you don't see side effects after the first 4 or 6 weeks after vaccination, you're not going to see long-term side effects. So, of course, we haven't had this vaccine around for years, but we've had many others. And so because of that, we can be very confident that these are extremely safe vaccines for adults, and it's looking the same way for kids, which is why the CDC will likely recommend tomorrow that it's used in adolescents age 12 to 15 and above.
Dr. T, here's another one. Many of the kids in this age group are just starting to go through puberty. So could the vaccine have any impact on their development or their ability to have children in the future?
Eddie, we're getting this a lot, and I want to be clear. There is no scientific or biologic plausibility for any reason that the vaccine should interfere with puberty or hormones or fertility. And by the way, we haven't seen that with COVID yet. There's no evidence that COVID infection leads to infertility or problems with hormones. So there's no reason to think that the vaccine will as well. Even though people are saying the COVID vaccine leads to infertility, that is misinformation, and that's an echo chamber that we want to try to really figure out the truth and not listen to that line of reasoning.
This next one is from a mom whose 13-year-old son has a heart murmur, and she wanted to know, could that put him at higher risk for complications or side effects if he gets the vaccine?
So the answer is no, and the good news is that this vaccine has been given to well over 1 billion people around the world, many of them with heart murmurs of one form or another, and there doesn't seem to be any issues. There's no cardiac or heart side effects.
But even in kids this young, though, I'm sorry to interrupt.
That's okay, but remember, we've seen it in the clinical trials with Pfizer, had over 2,300 patients that were that age. We've had 16 and 17 years old, so there's been no issue so far, no reason to think there'd be any problems. 2 thumbs up to that child.
All right. So this next question is a two-part question. First part is, we know that, is it fair to say that the vaccine seems to cause more side effects in younger people? Is that fair to say?
Yes and no. More injection site reactions, redness, swelling, but actually less reactogenicity, less fevers, less aches. So yes, there's more injection site reactions. We know as you get older, those injection site reactions get less. The elderly are the least likely to report that redness, swelling, pain at the injection site.
So given that discomfort, or maybe even slightly higher than that, should parents plan to let their kids stay home from school after each shot?
Wouldn't that be nice? I don't want to give a free vacation day. Listen, the truth is most of these side effects, by the way, are mild to moderate. So most kids will be able to go to school, but will there be some kids that they may have a high fever or something else and be better staying home? Sure.
Hey, Dr. T. Mazel tov on Brett's bar mitzvah over the weekend.
Guys, thank you very much.
Yes, congratulations. Speaking of kids, right? All right. Yes. Thank you so much, Dr. Todd.